Picture your brain as a bustling city, a vibrant hub of activity. This incredible organ is powered by a constant, unwavering flow of blood, its lifeline, the very essence of its function. Blood delivers vital oxygen and nutrients, ensuring every neighborhood, every cell can perform its crucial role. Now imagine a sudden disruption, a roadblock in this essential supply chain. A stroke is precisely that, a sudden disruption of this vital blood flow. This disruption occurs either from a blockage, like a traffic jam halting all movement, which we call an ischemic stroke, or it can happen from a burst vessel, a catastrophic leak that floods the system, known as a hemorrhagic stroke. When the blood supply grinds to a halt, brain cells deprived of oxygen start dying within minutes. Time becomes the enemy. The affected area, starved of its life source, rapidly loses its function. Suddenly, movement becomes impossible, speech turns to garble, or precious memories can vanish instantly, leaving a devastating impact. The longer the interruption persists, the greater and more irreversible the damage becomes. Every passing moment amplifies the potential for lasting disability. Strokes are not just a concern for the elderly. Anyone, regardless of age or background, can be at risk. It's a misconception that needs to be dispelled. It's crucial to understand this is not a heart attack. This is a brain emergency, demanding immediate and specialized attention. Unfortunately, modern lifestyles, with their sedentary habits, unhealthy diets, and chronic stress, have significantly increased stroke risk for all ages. Recognizing the signs of a stroke and acting with lightning-fast speed can be the difference between life and death, or between recovery and lasting disability. Remember, restoring blood flow as quickly as humanly possible is absolutely the key to minimizing the extent of the damage and maximizing the chances of a full recovery. The brain, the command center of your entire being, controls everything. And when it's under attack from a stroke, every single second matters, making rapid response paramount. Understanding this critical urgency is the very first step to protecting not only yourself, but also your loved ones and your community from the devastating effects of stroke. Stroke symptoms strike suddenly and without invitation. They can appear in an instant, changing everything in a heartbeat. There's often no warning, no slow buildup, just an abrupt change in condition that demands immediate attention. It's crucial to be vigilant. Watch for sudden numbness or weakness, particularly if it affects one side of the body. This can manifest as difficulty lifting an arm or leg. This is especially concerning when it's isolated to one side of the body, indicating a potential issue in the opposite side of the brain. Trouble speaking, slurred words, or difficulty understanding simple sentences are also key indicators. Confusion, disorientation, or a sudden inability to think clearly are major red flags that should never be ignored. Sudden vision problems, blurred, double, or loss of sight in one or both eyes can signal brain distress and require immediate evaluation. These visual disturbances signal brain distress, indicating that something is seriously wrong and needs prompt medical attention. Dizziness, loss of balance, or a sudden inability to coordinate movements can also be signs of a stroke. And a severe, unexplained headache that comes on suddenly, unlike any previous headache, can also mean stroke. These symptoms are abrupt and dramatic, often appearing without any prior indication of a problem. Don't second guess. Don't assume it's just fatigue or a migraine. Err on the side of caution. If these signs appear out of nowhere, think stroke first and act quickly. Time is of the essence. Quick recognition is critical because the sooner treatment begins, the better the chances of a positive outcome. Your fast action could save a life and minimize long-term damage. Don't hesitate to call for help. Assume stroke until a doctor says otherwise, and get the person to a hospital immediately. Every moment counts. Don't hesitate to call emergency services. In a stroke emergency, every second counts. Recognizing the signs and acting swiftly can dramatically improve the outcome for the individual experiencing the stroke. That's why it's crucial to remember the acronym FAST. This simple tool can help you quickly assess someone and determine if they are having a stroke. F. Face. Ask them to smile. Observe their facial symmetry. Is one side drooping or appearing uneven? This could be a sign of facial muscle weakness due to a stroke. A. Arms. Can they raise both arms fully and keep them elevated, or does one arm drift down involuntarily? This indicates potential arm weakness. S. Speech. Is their speech slurred, difficult to understand, or does it sound strange in any way? Tea time. If you observe any of these signs, even just one, call emergency services immediately. Don't hesitate. Prompt action is key. Note the exact time the symptoms started. This information is vital and helps doctors decide on the most effective treatment plan. Don't attempt to drive them to the hospital. Paramedics can begin providing critical care right away in the ambulance. Knowing and using FAST effectively turns you into a crucial first responder in a stroke emergency. Quick action based on FAST can mean the difference between a full or significant recovery and lifelong disability, significantly impacting their quality of life. Know FAST. Act fast. Time is brain. Save a life. Be a stroke hero. Preventing a stroke is possible. Up to 80% are avoidable. Control your blood pressure. It's the top risk factor. Eat a diet rich in fruits, vegetables, whole grains, and lean proteins. Cut back on salt, unhealthy fats, and processed foods. Exercise regularly. Aim for 30 minutes most days. Maintain a healthy weight and manage cholesterol and diabetes. Don't smoke and limit alcohol. Small, consistent changes make a big difference. Prevention is about daily choices, not drastic changes. Protect your brain. Start today. Your future self will thank you.